Hey team, Dr. Josh Wagner here. In this video, I'm gonna show you how getting a no, N-O, from your new patients will actually increase your retention. Dr. Josh Wagner with Patient Mastery, where we help awesome chiropractors like you become the go-to DC, financial freedom, more time off, and absolutely love practice. So here's the thing, retention is everything in chiropractic. Unless you wanna have a practice where you need to attract 40, 50, 60, 70, 80 new patients a month and only see them a couple of times and then they disappear and it always feels like you're banging a head against the wall. Retention is everything. It's your reputation, it's your income, it's what you knock out your student loan debts with, it's what gives you the ability for retirement, not having to chase new patients. Now, one of the things in chiropractic that repels retention is age-old sales tactics that we're taught from the chiro coaches of the late 70s, 80s that have just filtered down to the normal ones, which all come from the main sales tactics for any type of business. And you can probably relate. The types of questions that treat new patients like kindergartners. So for instance, it might say on your new patient intake form that you downloaded from the coach's website or the manual, how committed are you to your health on a scale of 1 to 10? And the person has to do a 9 or 10, otherwise you have to have a talking to them. That's a great one. Or a script in the consult, the recommendations. If we find the root cause of your problem, do you want us to tell you? Do you want to know? Again, you're treating someone like a 6-year-old, just really, really stupid communication and verbiage. Oftentimes, these are questions that elicit an obvious yes from the new patient. Are you committed to your health? Do you want us to tell you? Those things. It's just like the telemarketer calling you and saying, hey, do you have windows in your house? Do you like those windows being clean? Well, we have this window washing service. When a patient starts getting obvious questions that elicit an obvious yes, it puts them on guard, because for the past 30 years, every annoying salesperson has used that tactic. So be careful if you're doing anything like that. Hopefully you're not, hopefully you're already a little more involved than that. But here's a way to spin it, to do the opposite, that actually brings patients closer to you, more connected, more trusting, more open to move forward. And this comes directly from Chris Voss, who wrote Negotiate Like Your Life Depends on It. I did a 30-minute interview with him on the new patient process specifically for chiropractic, which is different than medicine. This was 4 years ago. It's in the member platform for Patient Mastery members. But one of the tactics he shared is a negotiating tactic. So he was negotiating with terrorists and kidnappers at the highest level. This stuff works. And it's called getting a no, N-O. So asking a question that elicits an obvious no response from the patient, but not a no to care or payment or plan or anything like that, a different kind of no. So here's an example. Let's say you're recommending to a patient who's got headaches and it messes with their sleep and it messes with their ability to have a social life. And I'm just throwing it hypothetically out there, a 2-month treatment plan. And you're describing what they get, you're describing, let's say, what they'll get, the initial frequency, the 2 months, and then asking this question, Mary, do you want it to be 2 months from now? And you still have these migraines daily, 3 times a week, preventing you from enjoying yourself on the weekends, being with your friends, and having your social life. Notice the question. That's an obvious no answer. However, it's not treating the person like a kindergartner. It's not asking them a yes question, which makes them go like this. It actually brings them closer to you and connected. And you can, you don't have to have the time frame. You could say, hey, do you want it to be spring? Maybe you do some weight loss and it's the winter and someone wants to be ready for bathing suit season. Hey, and maybe you work with someone for 6 months for weight loss. I don't know, don't get hooked on that. Do you want it to be Memorial Day and you still don't like how you look in the mirror in a bathing suit? Obvious no answer that brings the person to, what do I really want? I don't want, and again, this isn't gloom and doom. This is, you're just telling them what they told you. So you're not making it worse. Big difference. Last thing I'll share is, we hardly use this in patient mastery. This is just like one little communication skill. And we hardly teach, this is one of the 2 responses in terms of overcoming objections, but I hardly ever teach it. I hardly ever get questions on it. There's no emphasis put on it. You know why? Because whatever you put emphasis on, you get more of. So if we focused on overcoming objections, guess what's gonna happen? Doctors are gonna get a lot more objections, a lot more, I need to think about it, I need to talk to my spouse, let me wait till after the holidays, disappearances. And what I notice is a lot of coaches and groups in chiropractic focus so much on making sure you have the perfect objection, rebuttals, and responses. What does that tell you? That chiros are getting rejected, and they need that. So this is one way, if someone is considering, has some reservations, isn't in what 90% plus should be, like, hey, can we start today? Yeah, let's do it. Let's get started, is asking a question that elicits an obvious no. Hey, do you want it to be next season? Do you want it to be, where are we, April? Do you want it to be June? And you're still struggling with this low back pain, still not sleeping through the night, still compromised at work. Just leave it at that. Obvious no, and immediately it anchors that person to your care. Your fees are not for chiropractic, are not for the visits, are not for the plan. It is to get them back to their life and get their life back. So test it out today, have fun with it if you need it. It's really gentle, it's really professional, it really works, and it's not even a piece of the patient mastery puzzle. This is just something Chris Voss shared with me. It works for chiropractic, and when you're doing the patient mastery process, you don't need to overcome objections because you won't be getting any. People will be paying you so much easier. Whatever you want to get paid, they'll pay you, and still refer, follow your recommendations, and sing your praises online. It's that powerful, it works that well. If you want specific help, reach out to me, send me a message, just help. I'll hook you up with one of my coaches, have a free brainstorming game plan session for wherever you are to get to your next level. Every chiropractor is different, every chiropractor is unique. We help docs every spectrum from straight with no CA to a dozen team members, multiple locations, and multiple modalities, and everything in between. Because these principles work because you're dealing with the same exact patients, human beings. All right, you guys rock. You need anything, drop a question in, drop a comment. Let me know what you got from this. If you watched it live or the recording, and if you want personalized help, send me a message, help, and we'll start a dialogue. All right, you rock. Have an amazing end of your week.